and good evening. I'm Melissa Idris.
And I'm Sharad Kuttan.
Welcome to Consider This, the show where we want you to consider and then reconsider what you know about the news of the day. Now, tonight on the show, we have the Head of Mission and World Health Organization representative to Malaysia, Brunei and Singapore. Joining us on the show, Dr. Loh Ying Roo. Welcome. It's a pleasure to have you on tonight. I'd like to begin the conversation with perhaps getting a sense of your impressions of the Malaysian response to the public health crisis. Dr. Loh, what have we gotten right here in Malaysia, and have there been missteps in your opinion?
Good evening, Melissa and Sharad. Thank you for having me on this very exciting program. Malaysia is, like other countries around the globe, are facing an unprecedented crisis. And in emergencies, there are always challenges. But the government of Malaysia has taken a whole-of-government approach and a whole-of-society approach, and is closely monitoring the situation and adapting its strategy to the evolving situation. So Malaysia is, or let's say every country has its own strategy, but in principle they follow key elements which we learned about what to do to implement measures to contain outbreaks. And these are really to detect to the early identification of cases and emphasizing on tracing and quarantining contacts, managing cases with a different healthcare pathway. That means, for example, designating specific hospitals to care or wards to care for COVID-19 patients. They have had a relatively early introduction of public health interventions and movement controls, orders and their enforcement. Very effective communication, a whole of government and also a whole of society approach, really involving everyone. And most importantly, many of these approaches are lessons learned from SARS. And what we see in Malaysia actually is that with all these measures, the numbers have been decreasing. So since mid of April until mid of May, we saw a decrease of new cases, and the death rates have remained very low. So these are very positive developments. Yet, this is not time for complacency, so we must carefully monitor. COVID-19 is around. We are probably going to live with it for the next years until we have an effective vaccine and an effective treatment. So.
Well, I'm glad, Dr. Loh, that you've noted certain things that Malaysia has done well. Anything that Malaysia could have done better?
Well, I think Malaysia, like every country, has taken a very specific approach. Malaysia's strengths are that it has a strong health system, health services, a strong public health management system, and a strong civil service. So they were able to respond very quickly in Malaysia to the current outbreak. And that's because they have taken adjustments after the SARS epidemic and have a strong preparedness plan implemented in Malaysia. So I think the measures as we see them now, the numbers speak for themselves. Malaysia overall has done well. And what I also appreciate with Malaysia is the Malaysian government is very transparent with the numbers. So the numbers are all published on a daily basis. So this are probably as we speak, there's a press conference and the latest data are being presented. And what we see is that the latest infections are among foreign workers, migrant workers. This has been very transparently disclosed, and measures are being taken to test and treat foreign workers, provide access to treatment, and also to put in measures about their housing conditions, because they are vulnerable, and they are vulnerable not because they are foreign workers, but they're vulnerable because of their conditions living conditions which don't allow to prevent COVID-19 transmission. That means keeping physical distance and the basic hygiene and respecting the basic hygiene measures which we recommend.
Dr. Loh, I understand that, of course, in the onset of the pandemic, not every leader, globally was listening to the WHO, and I know there was frustration reportedly from your organization about the willingness of political leaders in different countries to take cognizance of this pandemic and its seriousness. I want to understand, what is the basis of cooperation between Malaysia as a country and the WHO, and was there a lot of cooperation, coordination between these two entities at the onset of the pandemic?
Well, traditionally, many of the countries, in particular during outbreaks, are listening and are expecting WHO's guidance and advice. And this is unprecedented. WHO has been working around the clock to provide and share information, collect data, and as we speak, under the international health regulations, which were actually instituted after the SARS epidemic, the world really has changed, and we have a system, a network of all the countries reporting to WHO and also reporting to each other the latest data immediately about outbreaks or early suspicions of an outbreak. And Malaysia is no exception. They have immediately, as soon as they detected cases, reported to WHO. We also share with them on a regular basis our new guidance, recommendations. We involve Malaysia, as we do involve other member states and experts from different member states, to help develop our guidance, because they are WHO. WHO is an assembly of member states and includes Malaysia.
Dr. Loh, we're going to take a quick break, but let's continue this conversation in just a few minutes. Stay with us on Consider This. Hi, if you've just joined us, you're watching Consider This. I'm Melissa Idris, with me, Sharad Kutan. We're speaking tonight to Dr. Loh Ying Roo, who is the representative for Malaysia, Brunei and Singapore for the World Health Organization. Dr. Loh, now earlier, just before the break, you talked a little bit about the WHO collecting data, sharing that data and sharing new guidance from WHO based on that data. I want to come back to what we know now for sure about this virus, about COVID-19, which may have changed perhaps in the early days of the pandemic, the outbreak. What do we know now for sure that we didn't know before?
So thank you, Melissa. It's a pleasure to be here with you. It's a very important question, and there's so many things we know and we don't know. So what we know is the numbers. We are 5 months into the global pandemic, and we have 6.3 million cases of COVID-19, and the cases continue to increase. And in some parts of the world, in some regions, including countries in Asia, we are seeing rates of new infections stabilizing or even declining. But we know from experience how quickly these trends can reverse. In Asia, we have seen lower death rates, actually, as in the global average and in other countries in the world, and that's remarkable. And there's no simple answer as to why this is. And at this stage, in countries of the eastern part of Asia, the Western Pacific region has just over 3% of the globally confirmed cases and less than 2% of reported deaths. And then if we look at Malaysia, the number of cases are fairly low, with around 8,000, and the death rates are less than 2% actually. So But we harbor a high number of population in this part of the world, as 1/4 of the population. So we know that some measures have worked, for example, the physical distancing, and we have also learned that measures like hand hygiene, like washing your hands, coughing into your elbow, and so the respiratory hygiene work in containing the epidemic. And in addition, we have learned that movement control orders like stopping mass gatherings have worked, and we also learned that closing businesses and schools where people move around, there are a lot of contacts, have worked in decreasing the likelihood of transmission.
Dr. Loh, I know there's a debate out there about the numbers, the infection rates, the numbers of people who are actually getting sick as opposed to just being positive with the virus. Singapore was very good until it opened up testing to those large dorms housing foreign workers and then found more. Our numbers, and some experts here are reading back from the death numbers to what the actual rate of infection or what the actual infection numbers are. Where does the WHO stand on this? Is it important to know how many people are positive, or is it more important to know where positive people are and sort of contain them? What is the thinking in coming out of the WHO?
So what we have learned so far and what we know is that critical in the response is that persons are identified, tested, diagnosed, and then isolated and treated, and that their contacts are traced and quarantined. And that's very important. So this is how we get the numbers when people are tested, and these numbers are reported. So it depends on the testing capacity of a country, and there are also indirect parameters to estimate whether the numbers are correct or plausible. So what we see, for example, in Malaysia, is that the hospitals are empty. So I think less than 20% of hospital beds are actually occupied. So that's plausible. The numbers are plausible. There are less deaths, there are less cases. So there are other parameters. You can look at influenza and lung infections and test COVID-19 cases among them. We see all going down. So I think the numbers are plausible, and the response has been solid, as it has been in many countries in this part of the world.
Earlier, Dr. Loh, you mentioned that we're probably going to have to live with this virus for quite some time. It's unlikely when we can pinpoint when this virus will disappear. What is the World Health Organization's thinking when it comes to living with the virus? What are the best practices as we look for exit strategies out of the lockdowns, as we're doing in many countries around the world?
Well, it is a very critical question. That's the key question we are all asking now. So it is not only about lifting the lockdown. It is also to have the measures in place which allow us to lift the lockdowns. But first of all, I would like to say that in Asia, most of Asia, basically no country in Asia actually has seen large-scale community transmission. That means the numbers compared to numbers in other parts of the world are much, much lower. Then the criteria which are in place, like early identification of cases and emphasis on tracing and quarantining contacts, management of cases with different healthcare pathways, relatively early introduction of public health interventions, movement controls, and most importantly, the enforcement, effective communication, and a whole of government and whole of society approach. All these elements have to be in place to allow that lockdowns and movement control orders and travel restrictions are gradually lifted. But we also have to be prepared to reintroduce them, and we have seen that because numbers of cases have to be carefully monitored, but not only the number of cases of COVID-19 cases, but also the multi-source surveillance, how we call it, is getting data from different sources, like from influenza, from influenza patients, or from patients with lung infections, looking at the hospital occupancy rates, excess deaths, things like that. So there are many sources of data. So we have to be vigilant and be ready to reintroduce these measures. And we have seen that in Japan and Korea. They lifted. They saw a surge of new cases, not very high, but they were worried. So they have reintroduced measures like that. And I understand that the government of Malaysia is ready, is very carefully looking at the data.
All right, Dr. Loh, you have Singapore and Brunei under your remit as well. The Singapore Johor Peninsula Malaysia border has been closed. It affects many thousands of lives. Can that be reopened? What practical, when thousands, literally hundreds of thousands of people go past that border they did before? Is it possible? Is Singapore an existential threat to Malaysia? Malaysia an existential threat to Singapore when it comes to the virus?
No, that's a difficult question. I think this is something which the two governments would have to discuss. There are not only disease transmission it's not only about transmitting diseases, but it's also there are political and economic reasons if they decide to open the borders. I understand that there are discussions among many countries now to start travel between countries. These are early discussions, and these are very complex, high-level decisions which have to be made.
All right, so we're going to take a quick break. More with Dr. Loh in just a few minutes. Stay tuned to Consider This. Thank you for staying with Sharad and I on Consider This. Let's continue our conversation with the World Health Organization representative for Malaysia, Dr. Loh Ying Roo. Dr. Loh, let's take a look at the World Health Organization in a global context now. We had the US President Donald Trump accusing the WHO of mismanagement and covering up the spread of COVID-19. I'm just wondering what that impact has been. What has the impact been for the WHO in the US, kind of pulling back its support for the organization, especially at this point in time?
It is very regrettable. The contribution of the US government and its people to global health and public health have been enormous and valuable. We have been working very closely with technical partners from the US government and including myself personally, and we hope that this important collaboration will continue. And particularly in a time where we face a global pandemic of this magnitude, we really need solidarity, unity, and vigilance. We need all hands on deck working together.
Dr. Loh, I understand that not everybody knows or is familiar with the WHO in terms of its structure. I understand your annual budget last year was only some $2 billion US, which is quite small considering you're covering the globe. In terms of capacity, in terms of resources, is the WHO in fact hamstrung by the limits placed on it because it's a multilateral organization, because of budgets and other kind of constraints that it doesn't have powers over member states? What could change? Will the pandemic change the way the WHO operates in the future, with or without Donald Trump's help?
Well, you have to maybe go back in history and look at WHO. It was founded after World War II by the member states as part of the United Nations, as a specialized agency. And its program and its budget is decided, it's funded and decided by the member states. In addition, we are getting additional funding, but you know, our governing body is not a board of directors, and you have like in a company or in other agencies. we are an assembly. We are mandated, and the member states, they make the decisions of the program priorities, how much is being allocated, and so we are the secretariat. So I think what you are implying and what some people think is that we are coming like a health agency which tells the government, this is what you have to do, you have to report. If you don't report, we will punish you. That's not how it's working. It's about diplomacy, working with the governments and have a close working relationship with the Ministries of Health, which are actually constituting the WHO. Your Ministry of Health in Malaysia is a member of WHO and is determining the directions of our program.
Dr. can I ask you if you think there is a trust deficit now, especially because there's been questions over the World Health Organization's handling of the pandemic. Has that impacted its ability to provide guidance to countries? Do you sense a trust deficit?
Well, we had just the World Health Assembly, and we had global leaders, we had prime ministers, several prime ministers speaking at the opening of the World Health Assembly, and we had so many ministers of health, delegations participating and releasing a resolution on COVID-19, and with a strong support to WHO. And that has been unprecedented and not seen in this way during a time where we cannot assemble. So I think that there's a lot of solidarity among the member states. They do understand that a body like the World Health Organization is needed for sharing information, early sharing information, and bringing people together to develop guidance or to release guidance, to validate and analyze risks and data together. It is in particular in these times, there is no other body which could, or agency, which is in the same position, which is constituted by the different member states, which is large networks, and a large network of focal persons in all the countries who are linked together and working together. Same for the experts. WHO is at the forefront in coordinating and bringing together scientists, promoting more collaboration and early information sharing between scientists to develop vaccines, to find treatments. So I don't see I don't see that this is happening, that there is a distrust.
Okay.
But constantly WHO is evolving. It has to evolve as the world is evolving around it.
Dr. Law, a question about the if and when of a vaccine. What will the WHO's role be, especially in terms of access and equitable distribution of the vaccine?
Well, WHO is traditionally has been at the coordination, bringing researchers together and sharing and promoting early information sharing and partnering with other agencies to support rapid vaccine research. And we know that there are currently 10 candidate vaccines in clinical trials, and I think several. Let me see, several hundreds in preclinical development, 120 in preclinical stage of development. So the role of WHO is, once a vaccine is available, is to help, and we are planning for that already now, to prepare for equitable access of vaccines, and in particular in emergency situations for outbreak. That's a very complex undertaking. But before it comes to that, we will have to have a vaccine. We have to have the production in place. There are many aspects to be considered.
Well, Dr. Lau, I really want to thank you so much for speaking with us tonight. We really appreciate your time and for you sharing your insights in the position of the World Health Organization. Unfortunately, that's all the time we have for this episode of Consider This. I'm Melissa Idris.
And I'm Sharad Kuttan, signing off for the evening.
Thank you so much for watching, and good night.